Today has seen 2 new cases overseas acquired and in hotel quarantine, which is great news again for Queensland, which puts us at 27 active cases. And again, I remind everyone, if you have any symptoms whatsoever, we want you to keep coming out and getting tested, and of course coming out and getting vaccinated. And we hope by the end of today we would have seen 50% of all eligible Queenslanders having had their first dose already. But of course we want to see those numbers grow even more, and as we have more vaccination centres coming online, as more supply comes in from the Commonwealth and into the country, we will be able to see those numbers grow. But also I want to remind everyone that they can book in with their GP and also community pharmacies anywhere across Queensland to get vaccinated as well. We want people to take up all of these opportunities. And again, if you've been vaccinated, asking your friends, family members, loved ones, work colleagues, have they been vaccinated? If not, why not? They should go out and get vaccinated straight away. Let's not wait until we have a big outbreak. Sadly, we're hearing from New South Wales there's been 2,061 cases now linked to that cluster that started on the 16th of June and around 89 deaths. So we just have to be vigilant every minute of the day to ensure that we don't have this virus coming into the community and spreading without our knowledge. So please keep coming out and getting tested. Now today I can report that the Griffin report, which was initiated as an investigation when a staff member at the Prince Charles Hospital was diagnosed on the 29th of June with COVID-19. There were concerns at the time that this person should have been vaccinated under the directions that were put in place at the time, requiring anyone working in the COVID ward or immediately around a COVID ward to be vaccinated. The Associate Professor, Dr. Paul Griffin, and Ms. Catherine Taylor, who is an infectious disease nurse from the Wesley Hospital, both conducted the investigation. And this report went to Cabinet today, and Cabinet has now approved of the release of this document, and it is already on the Queensland Health website for people to see. As far as any reductions in this report, I can confirm that the only thing that has been redacted from this report is the names of the actual individuals that were interviewed, which were in Annexure B, but their actual positions are still there for everyone to be aware of. Importantly, what the findings of this report has shown is that no unvaccinated staff member had entered the COVID ward at the Prince Charles Hospital. There is no evidence that Metro North Health Hospital and Health Service or any individual failed to comply with the interim infection prevention and control guidelines for the management of COVID-19 in healthcare settings. That was set by the Chief Health Officer direction. That Metro North HHS had the appropriate policies, procedures and practices needed to comply with the direction with respect to movement of patients, staff and third parties, that the Metro North HHS had the appropriate policies, procedures and practices needed to comply with the direction in respect of vaccination of workers, and that the Metro North HHS officers had an appropriate level of knowledge of and compliance with the policies and procedures for working in the COVID ward. In relation to the individual staff member herself, the finding at page 16 on the report specifically says that the investigators can ascertain that there was no evidence of any Metro North HHS officer or third party having entered the COVID ward without having received at least their first dose of COVID-19 vaccination. And as the concierge was not required to enter and did not enter the COVID-19 ward and did not provide occasional or intermittent care to a COVID-19 positive patient, they were not required by the direction to be vaccinated for COVID-19. So not only did this individual not go into the ward or provide any occasional or intermittent care that would have necessarily required them to be vaccinated, no other staff member has entered the ward unvaccinated in breach of the policy. So that's really positive findings. We thank the investigators for that. Of course, they have made recommendations of what we can do to improve even more. They have recommended a limiting of entry points to the COVID wards, and where it's not practical to limit to one entry, placement of a concierge and improvements to signage at the alternate entries. Consideration being given to mandating the vaccination for all workers in proximity of COVID wards, such as those working in the same building, and additional measures to ensure electronic swiping into and out of the COVID ward is as accurate as possible, for example, by not swiping others into the ward as an act of courtesy. So what they've found is, while staff members are going in collectively together, and one of them may have had their hands full, then another person has swiped them in who has also been authorised to access. So it's not about unauthorised access, but it's making sure that there is a correct record of everyone swiping in and out. It was found that there was very few examples of that occurring, but that we should put in place measures to improve that. And I know the HHS is already looking at these recommendations. In relation to the recommendation around expanding the definition of who should be vaccinated, we welcome the recommendation. However, our view is it should go further. So our recommendation is we should be vaccinating everyone who is in COVID hospitals, and I can advise that we have very high numbers already. In fact, over our medical professionals and clinicians, we have 90 to 100% already had their first dose, and across other health professionals we have 85% or higher. Our lowest figure is around 74 to 75% for first doses. That is in the administrative, clerical, managerial streams of the hospitals that aren't operating anywhere near the wards. But of course we would like everyone to be vaccinated, and we are working with all of our hospitals and all of our COVID wards. There is about 83.8% have already had their first dose, and 77% of every single health worker in those hospitals where we have COVID wards are already fully vaccinated. 77%, all fully vaccinated. That is clerical, cleaners, security, wardies, nurses, doctors. So that's a great result. It's probably the highest figure I've seen across any professions across the country. So I'm very proud of our health workers coming forward and getting vaccinated, but we want to continue to work with them to get that even higher still. As far as how this transmission occurred, it wasn't part of the terms of reference for this particular report, but we know no other health worker actually was tested positive, so there is no evidence that this individual's health worker was infected by an intermediary. We do know that she is directly linked to one of the positive cases in the ward, but there is nothing that is identified so far as to how that transmission occurred. What we do know globally and nationally is that you can get transmissions in hospitals. We've been very fortunate to keep that extremely limited here in Queensland. But sadly, what we are seeing in New South Wales now is 1 in 5 people who are dying as part of this current cluster have gone into hospital or been in hospital for another illness or condition and actually contracted COVID while in the hospital and has died from it. So we want to do everything possible to reduce the transmission that can occur, because we know, and we've said this from day one, whether it's hospital, whether it's hotel quarantine, whether it's the community, this is a highly infectious, deadly virus that you can put in place the measures to lower the risk, but you can never fully eradicate that risk. So again, I thank Dr. Paul Griffin for this report, for all of the staff who cooperated with the investigation, and we welcome the recommendations and findings, and we'll be working to implement these recommendations as quickly as possible. Dr. Young.
Thank you, Minister. So no new cases in the community in Queensland today, which is excellent. But the most important thing we all need to do going forward is to get vaccinated, because now New South Wales has tipped over that 20,000 number for their cases in their current outbreak, and we know we're seeing more of those cases coming closer towards our border, so they will eventually cross. We know that, of course. So it's really important that we continue to vaccinate, and every day we stop that virus crossing into Queensland gives us a chance to vaccinate another 50,000 people. So it's really important. But please, could everyone come forward and get vaccinated when it's made available to you. So we're now vaccinating anyone who's aged 16 through to 59 in our facilities, and GPs and pharmacies are vaccinating people 60 plus they're also starting to, as they get increased quantities of Pfizer in their sector, they're starting to vaccinate younger people, and mid-September we expect to get Moderna, and that will be another group that we can then start vaccinating using Moderna. So it's available for 18 years plus. So that's all very, very important. Now, I just want to thank the Prince Charles Hospital for their response to managing COVID cases. They have managed a significant number going through, and as we all know, and we're here today talking about the Griffin report, that they did have that transmission. But that transmission didn't go any further. So there are only 3 people involved in that event. The original case from overseas who was being managed in the ward, and then the receptionist who sat outside the ward, and she passed it on to one family member. But despite a lot of testing being done all through the Prince Charles Hospital and through Magnetic Island and Townsville and other exposure venues, we didn't find any other cases, which is a fantastic effort by that individual, that she minimised that transmission, by her household members who also worked with us, and by the hospital in terms of their policies and processes that meant that we had spread to one person but not to anyone else, which was a fantastic outcome. So I commend them. I thank Dr. Griffin for his report. He's given us some additional recommendations, which of course we've looked at and will implement. So the first is to broaden the number of people being vaccinated, and of course I would like every single healthcare worker, and the vast majority have already taken it up, to be vaccinated, not only those in our COVID hospitals, but every single health facility in the state. I think that's absolutely critical to protect themselves, their families, so they don't take it home to their families, and also, of course, their patients. And we know that's what health workers always want to do. They want to protect their patients. So that is progressing and rolling out rapidly with very good outcomes. The other point that he made was that we need to minimise the numbers of entries and exits into our COVID wards. So we're going to do even further work on that to just prevent people unnecessarily going into the ward. Not that he found evidence of that, but it was a very astute observation which we'll then put in place. Thank you.
Minister, the Premier has blamed the hospital, the health service for not following the direction. The reports found that this worker was told that the vaccine was optional. Has the government now accepted the public health direction was made and wasn't written properly?
No, not at all. What the report showed was that this person was not in the immediate vicinity, in that they were either occasionally or regularly going into the COVID ward and having contact with COVID patients. So there was no evidence that this person should have fallen within the direction. Having said that, the finding is we should consider broadening the direction to pick up more staff. But interestingly, even the recommendation itself only suggests that we go outside of the COVID ward but not to the whole hospital. We want to go further. So we welcome the recommendation, but we actually want to vaccinate a lot more people at the hospital than what the recommendation goes to, because we don't want this grey area. We don't want people who may not be directly linked to the ward but still in some way have some contact that could get infected.
She was stationed just 15 metres from the door. The shows that at the time it's just semantics, whether you're in or out.
Look, we acknowledge the findings. That's why we did an independent investigation. We wanted to satisfy ourselves and show the public full transparency about where this person was situated, what their role was, and whether they should or shouldn't have been vaccinated. Well, the fact is, the report says no one has breached any policy. So we're not going to go trying to find someone to punish when the report says that there is no wrongdoing here, that no one has been found to be in breach. Sorry?
What about the people who wrote the policies?
Well, we can't criticise the people who made the policies at the time because one person who isn't directly involved in the ward themselves got infected. The policies and procedures are in place. They were followed. Can we improve the policies and procedures? Yes, that's why the recommendation is what it is. But we didn't wait for this recommendation. We said at the time, we want to see everyone in every one of our COVID hospitals vaccinated. And we now have 77% of every single staff member in those hospitals fully vaccinated. And over 83% have already had their first dose. So we've done that without mandating it so far and without actually having this recommendation at that time.
Wrong. I thought you said at the time you would like to see somebody sacked though.
Well, we said very clearly that if someone has done the wrong thing here, they should be held accountable. But we held a proper investigation independently to find out, well, has someone breached the policies and the directions here? Who is it? And what should be done about it? Now, the findings are what they are, which is no one's done anything wrong.
She didn't have to be vaccinated.
That's right.
Does the Premier sort of have egg on her face then? Because she said someone will be held responsible. That was the quote. And it seems no one's being held responsible.
Well, no one's, let's be clear, the report has been independently conducted. It has been very thorough investigation. You'll see the list of interviews.
So did the Premier jump the gun, I suppose?
Oh, look, I think we were all very passionate and upset at the time. We were very worried, remembering that this staff member had gone and travelled with their family to Magnetic Island. We were very worried about the possible consequences of that and the transmission. And based on the information we had at this time, I think any rational person sort of thought, well, why wasn't this person vaccinated? But we did the right thing. We didn't race off and go, right, you're responsible, your head must roll, let's do an investigation, let's make sure it's independent, let's do this right, and that's what we've done.
We still don't know how she was infected.
Is it likely it was airborne transmission or?
I'll ask Dr Young to comment on that, but we may never, like many of these, like our hotel quarantine, we can rule out certain things. We can rule out that the positive patient didn't give it to another staff member who then came out of the ward and gave it to this young person. There's no evidence that other staff members were infected. So, as has often happened over the past 19 months, there's things we can rule out, but we can't definitively say how the transmission occurred. But I'll get Dr Young to see if she wants to add to that at all.
You're absolutely right, Minister. No, I don't think we'll ever know how it happened. We just know there have been those 3 cases because whole genome sequencing, and we do whole genome sequencing on every single case in Queensland, and we've not found any other case that clusters as with these 3, and we've tested a lot of people. So I don't know how it happened.
Just on that recommendation, you mentioned you want to go further with respect to vaccination, but the recommendation is mandate, not sort of that you want targets. So do you accept the recommendation to mandate COVID ward building? So anyone?
Yeah, we've already said. So they talk about expanding the area. They say it could potentially go to the building. We've actually said, the whole of the hospital, the whole of the hospital grounds. We've already said that we would like to mandate vaccinations for everyone working at a COVID hospital. We've already said that. We have in-principle support from the stakeholders to do that, and we're just working through the logistics of what do we do with those who either can't or won't get vaccinated, because we also have an obligation to make sure we have sufficient staff at the hospital to deliver the healthcare that's needed. So, but while we've been doing that, we've been pushing ahead to get our vaccination rates as high as we possibly can. And in some cases, I've got 100% of clinicians vaccinated and other health professionals at the 90% mark, which is very positive.
It also says third parties though, so presumably electricians, tradespeople showing up to a building that contains COVID.
And we're already working on that as well. Same with our students. So Dr Young has already required health students coming onto site also to now be getting vaccinated.
So how do you practically enforce that? Is someone at the door checking anyone who comes and goes?
Well, that's why we've taken our time in getting this right as to how to operationalise it. it will be up to the chief executive and the management at each of the hospitals to figure out how they manage that and oversee to ensure that the staff are vaccinated. But as you can see from this report, we're already doing that. We're already doing that by making sure that not one person walks into a COVID ward unvaccinated. They've been able to do that, and very successfully, and as this report shows, there is no evidence of anyone accessing a COVID ward at the Prince Charles unvaccinated.
Dr. Young, sorry, after this outbreak, you said, of course she should have been vaccinated. I believe that is semantics, the fact that she was stationed just outside and wasn't vaccinated. Whose fault is it that she wasn't vaccinated?
I genuinely said that, and I believe that we should vaccinate everyone who works in a COVID hospital. That was my view back then, but we've got to get there. You can't do things overnight. So that's the work that's been happening, and the vast majority of people, once the vaccine's been made available to them, have gone and got vaccinated.
But if people were working in hospitals, we had people who weren't as vulnerable to COVID getting the vaccine before these people. Why was that allowed to happen?
Sorry?
Why do you think that was allowed to happen with the rollout of people who are less vulnerable were getting vaccinated before people who are stationed 15 metres from the door of the COVID ward? Do you think that the public health directions were written incorrectly?
No, I don't. I think we needed to make the vaccine available, and that's what we've been doing over the last few months. We've just been making it more and more available.
Do you regret those comments now?
No.
But
I firmly believe that anyone working in our hospitals should be vaccinated against COVID. We haven't been able to do it as quickly as I wanted due to a slow rollout of supply. Now we're getting more and more supply every single day, and I've just been told today we should expect Moderna middle of September. That will help as well. So as we get more supply, then I want people to take it up. We do not have any empty bookings. We've got 100% of our capacity to vaccinate is being taken up in Queensland. If we could get more doses of vaccine tomorrow, we'd use it.
I might just pick up on Lydia's question about why were vulnerable people prioritised over health workers. They weren't.
Not vulnerable people, people who weren't as vulnerable.
It's not accurate. They weren't. We have been making vaccinations available at our hospitals from the day we moved into stage 1B. Every single health worker has been able to access a vaccination if they want it through the entire 1B stage.
But you had at your, like the Stars Hospital, people could call up and say, have you got any doses available? There were walk-ins. After this happened, the government stopped doing that to ensure that there are enough vaccines.
But that didn't apply to health workers. So we had walk-ins off the street coming in to get vaccinated. Health workers have never ever been turned away. We have made sure, and we continue to this day, if you are a health worker, you are prioritised as far as vaccination. And we have really high vaccination rates. I would like to see any other jurisdiction, I know New South Wales are just looking at mandating now, show me any other jurisdiction that has in some areas of their hospitals 100% vaccination and 90% fully vaccinated. That's pretty extraordinary statistics considering it's not mandated yet.
The plan is now to vaccinate everyone working in the hospital.
That's certainly, well, what we've said is we want to mandate it for every health worker working in a COVID hospital. Now, of course, we would like every health worker across the state to be vaccinated. But
the Indian women's cricket team is now in Queensland quarantining to play a series of matches against Australia. Why are they allowed in Queensland to start on?
Look, I'm not aware of the details of the approval. I don't do the approvals in relation to coming into hotel quarantine and the exemptions, but I'm happy to follow up while they're there.
Minister, just on the truckies who blocked the M1 this morning, what's your response to that? They say they're at breaking point and they want great choice over the vaccine and over lockdowns. What do you think?
Look, I'm concerned. We know that our truck drivers do a very critical job across this country. They keep supply moving. That's why there has been special exemptions for truck drivers and particularly freight operators from day one. When everyone else has been stopped from moving back and forth on the roads and borders, freight has been allowed to continue because they are so critical. I don't think it's unreasonable though that some of those have to be vaccinated. But the National Cabinet decision is actually about testing, not vaccinations, testing. So National Cabinet has agreed, no matter where you move around the country, that they have to undergo a certain testing regime. But I would hope every freight driver, every truck driver would want to be vaccinated. We've just seen 2 positive freight operators in Western Australia. So it's about their own safety. They're moving in and out of communities that are hotspots. I would hope that they would want to get vaccinated. Now, we have made sure that we're providing those opportunities for them as priority workers to come forward and get vaccinated. And we encourage them to do that because it's really important. As far as choice of vaccine, but they've got to talk to the Commonwealth. Our hands are tied there. We have a limited number of Pfizer, and I don't know the volume we're getting of Moderna.
They're saying choices in, it should be their choice whether they get vaccinated or not, and some are saying they're going to go broke because they don't want the jab.
The reality, though, is they're able to move back and forth over borders when many, many other people around this country can't. And we know there's a risk. We know that freight operators are moving in and out. They're going to distribution centres. They're moving through towns that are hotspots and into other jurisdictions. And we've just seen 2 positive cases. So if the question is, do they need to be vaccinated? You only need to look at Western Australia. They've just had 2 positive cases from freight truck drivers. So it is in their best interest to be vaccinated, but it's not just about them. It's also about their loved ones, their family members, their neighbours, their community, because we know for every person that's vaccinated, it reduces the risk in our community.
There's some pretty serious accusations there. What's the government?
Look, these accusations were actually put to my office over a month ago, so I was a bit surprised to wake up and see this in the paper today. So this is not a story that broke overnight. My office was asked for comment a month ago on this, there was no request for an update at all before this went to print. What I can say in relation to this, they are serious allegations, and anyone who has any evidence around these allegations should go forward to the relevant authorities. It is incorrect to say that these cases haven't been looked at, that they haven't been reviewed. Where there are unexpected deaths, they have gone to the coroner. And I can advise that the 3 cases raised in the media today, that the Caboolture Hospital's Performance Management Committee examined these matters. They were elevated. They have been considered by Metro North HHS's executive committees. I've asked for an update on the outcome of those investigations. And those matters are ongoing. But I do encourage anyone, and this includes the Professional Nurse Association, you can't just say we have it on good authority. If you have evidence, provide that evidence to the relevant authorities, and whether it's the coroner, whether it's the Director General of the department, whether it's myself, whether it's the Health Ombudsman, or the CCC for that matter, you have an obligation as well, as do staff members, have a duty of care to bring information forward if they have evidence in relation to these very serious allegations.
Given the Sydney outbreak that's happening at the moment was essentially sparked by a bit of a loophole or a gap in, I suppose, policies and guidelines, is there any plans to look at a review of other health directions in place in the state to see if they are doing what they need to do?
Sure. We constantly review and we constantly make sure that we are providing the best directives we can. So after the Grand Chancellor, we did a thorough investigation. We updated our practices. We will update our practices again after this. So we will continue to improve our practices, not just from our own learnings here, but I know Dr. Young speaks with her colleagues every single day, and they're talking about learnings in other jurisdictions, which also led to the reason why the Premier stood up the other week with our multicultural leaders to talk about getting vaccinations out into those communities, because we're taking the learnings from what Victoria and New South Wales has seen, where they've had major outbreaks in these communities, and making sure that we get ahead of this and we do it far better and make sure that we get these communities vaccinated before we see major outbreaks.
Thanks, guys.
Do you know how border bubble discussions are going with New South Wales when they're likely to be
No,
resolved?
as far as I know, they're still ongoing. We are still open to trying to resolve this issue. We know the disruption that it's causing. We put a proposal on the table last year. We've done it again recently, and we are happy to have those discussions. But New South Wales has to be willing to actually look at changes to where those checkpoints are set up, not just Queensland should loosen up their restrictions. Let's remember what's happening here in Queensland is because New South Wales has a stay-at-home order for the whole state. The entire state is in lockdown. People aren't supposed to be moving outside of 5 kilometres. So it's not that Queensland is restricting New South Wales residents from moving. New South Wales residents are restricted from moving by their own state government's lockdown requirements. What we are trying to do is saying there are pockets of people in that border zone who could be operating and living under Queensland's level of restrictions, which we know are one of the lowest in the country right now, if we shift where those checkpoints are. The ball's in New South Wales courts as to whether they want to do that.
Thanks, George.